Hello, welcome to week 9. I'd like to just give you a preview of your assignments that you're going to have this week. This week, we're going to be learning about diabetes, the reproductive system, and breast problems. I would like to just congratulate you. You are now halfway through the course. That's really exciting. So just hang in there. You're over the halfway point. In the words of Winston Churchill, continuous effort, not strength nor intelligence, is the key to unlocking our potential. So let's get directly into Module 1, which is diabetes. This is really where the most content of Week 9 lies. I have posted a diabetes PowerPoint here from Chapter 53 in the Lewis, and I've got it down to around 160 slides. There is a lot of diabetes content to cover this week. The original PowerPoint was well over 250, so I've gotten it down based on the key words and terms for that chapter. Before you start your studies this week, would you please do me a favor and watch this diabetes video? And while you're doing it, be thinking, what do I already know and what is new for me to learn? This document, this compare and contrast, can be downloaded. And as you watch the video and as you read, use the compare and contrast activity to actually, and I'm going to show you what it looks like here, to compare and contrast type 1 diabetes and type 2 diabetes, age of onset, initial presentation, cure, treatment, risk factors, and cause. Still in Module 1, we are going to read ATI, chapters 82 and 83. It's an overview of diabetes and complications. Then, as always, check your understanding with the 5 application exercises at the end of the chapter. Then please read Lewis chapter 53. There are 3 SurePath lessons that are optional in the optional lessons folder. They are visible, but they will not be graded. Some of you have indicated that you prefer to do the lessons rather than read the book because it gives you an opportunity to practice your understanding with the Quizlets. And so please feel free to do so if that meets your learning style. As I said, there's a lot of content in diabetes. You've got quite a few vocabulary terms here. And then under care of the patient with diabetes, we've got hyper versus hypoglycemia, differentiating between type 1 and type 2. What is the main problem of type 1 diabetes? Treatment during acute illness and surgery, laboratory values, oral agents, insulin types, then administering sliding scale insulin, hypoglycemia, self-monitoring of blood glucose, nutrition and exercise, and then chronic complications and foot care. And then on the right side are some sample questions of what to expect when you are tested over diabetes. Then you are going to go into SurePath and practice your knowledge. And there are 3 diabetes mastery quizzes: diabetes, management of diabetes, and complications of diabetes. These quizzes are pass fail, and they will increase the difficulty level until you reach mastery. It will provide immediate feedback for each question. The quiz is auto-regulated based on your amount of correct responses. The number of questions will be based on your knowledge. So if you answer correctly, you will have fewer questions. So based on that, I would highly suggest that you do all of your reading and your compare and contrast activity and or your lessons, if you prefer to do it that way, before you take that mastery quiz. So going into Module 2, that is the reproductive system, assessment of the reproductive system. Again, there is a PowerPoint posted here, which are the big ideas for the module. And then there is a video, and there I would like you to think, what do I already know and what do I still need to learn? And then we are going to be reading ATI, chapter 62 and 65, Lewis, chapter 55 this week. Here are our key terms, and then our tables to study and focused assessment, and then our diagnostic studies to review. And then again, you're going to go practice your knowledge in SurePath with the Mastery Reproductive Assessment quiz. And Module 3 this week is all about breast problems. And you are going to be reading Lewis chapter 56 on breast disorders. And there are also 4 SurePath lessons that are in the optional lessons folder that are not graded. These are our vocabulary and then our key ideas for this chapter, and then our lab values that we need to study. And again, you will have 2 quizzes in SurePath that are mastery quizzes, pass, fail, breast problems, and breast cancer quizzes. So same thing. Please do your reading and your exercises before you do the mastery quizzes because it's based on the number of correct responses. And the final assignment is Shadow Health Endocrine System Hourly Rounds. I would like to remind everybody that Shadow Health does not feed your score into Blackboard. So I will upload your scores into Blackboard after the assignment is due. So until then, you will be able to see your own scores in Evolve. Uh, You can see your results and your score inside Evolve, and a minimum score of 80% is required for credit. You can do this as many times as you like. You can complete it multiple times, but it does require 80% for credit. And then we will have live class this Thursday from 7 p.m. to 9 p.m. And I'm also going to do a test review Wednesday night from 7 to 8. And I will put that on this section. I just forgot to load that before I started the video. So I think that's everything for this week. Good luck. And I will be posting a link to this video for you this evening. Thank you. Bye-bye.